for Restore Hope Under Families. We have Deanna here as well. Deanna is welcome. I'm honored to be here today. You all, our theme for this month is whole family, bridging gaps in dental, physical, this ain't working, mental health and disability support. With a powerful reminder that we have to understand how it all intersects, how it intertwines. Mental health, oral health, physical health. It all plays a part with each other. We're going to talk about that. We have two panelists here today, amazing men that are doing work in the community. We would like for you guys to engage in discussion, talk about just physical health, mental health, and the importance of the dental health for the community. We're not just gathering as professionals in the community and in the work that we're doing, but we're here to talk about how we can collaborate as an alliance, working together to bring all of the pieces so that families don't fall between the cracks. I'm sorry, y'all, I gotta come closer. Number one, my voice is tired, and I'm not trying to talk a lot because I have a funeral to sing. Anyway, we know that a child's untreated or a family's untreated dental issues can affect not only their learning, but untreated trauma can turn into lifelong health problems. The family's navigation between any type of disability, without the support, it can also carry invisible weight. And we know that when those needs are addressed in different silos, then our families are the ones that's suffering. So we're going to have some intentions this morning. We're going to listen deeply to what our panelists have to say, and most importantly, we're going to identify how we can work together to create more coordinated, compassionate, and effective care to the families that we serve. Some of the desired outcomes for today, shared understanding. So we want to do some shared understanding, develop a collective understanding of how the physical, dental, mental health, how those services intersect and how it impacts our family. And we're going to identify some barriers and some gaps. We're going to model collaboration and do some data and show how Hope Hub and the systems that you can be a part of to communicate with one another can help the families that we're serving. So together we're going to challenge the idea that any one sector can't do this alone, because whole families deserve whole care, and together we are the bridge. So I'm going to have Deanna to come up. She's going to share some data with you all and go over some of the things, show you the work that you've done as a collective impact and how it has helped families in our community. Deanna?
As you guys all know, is 100 families and for the community meeting, and many times the way that it works is we're all running in different areas, many times doing because but when we are able to come together and all work in the same direction, we absolutely together change not just our maintenance lives, but our whole together. We do that. I think now I do through collective impact. And just like all of our alliance members in this room today, and hopefully some new friends, we together have a common agenda, and that is that we together are going to help families move from crisis onto stability and then onto career. And so, as you guys know, we collectively, and we'll show that in just a minute, we utilize shared measurements together. We all come together under mutually reinforcing activities and together continuous communication. And we in Pulaski County have the backbone support of both Restore Hope and Every Arkansan. And so, I think I'm okay now. The 100 Families Initiative, we are community-led. We're engaging our partners and alliances. We're training agencies on Hope Hub, which is our collective, collaborative case management system. And we're recruiting our family advocates to help navigate between our providers and the families that we get to serve together. And so with that, here's a fun thing that I am super excited about. And that is our data is officially live. So this is the first time I get to show you data as it is in the exact moment, as of right now, at this minute. And so, as you guys all know, we are serving in 19 counties in Arkansas. And this has been hard. And in Pulaski County. As a total in Arkansas, we are serving 1,749 families collectively together. And so, to move a little closer, which is also live data, you have, it looks a little different than it has in past months. And what we can see here in the last 365 days, including this morning, we have collectively, as a whole, served 561 here in active families in Pulaski, and collectively as a whole, like I said, we year to date, so here's year to date, is we have served 2,126, and so that's just since January. And so the collective impact, as you can see, is the movement of when our families first came to us versus where they are today's date. And you can see the impact that you all do. Now, always my fun, because Pulaski's kind of my favorite. This is an even farther zoom, and I had notes. I can't see them though. In Pulaski, thank you. I want you to see something. In Pulaski, in the last 564 days, we have served 564 families together, and that is amazing. And we have done that as impact. But I also want you guys to see one little number right here. Year to date, so this is since January. Since January, we've served 400 families together, and it's not even to June yet. It's not even the first half of the year, and so I cannot thank our providers, our community, our advocates, everyone who is making this possible. And in that, one of my favorites, of course, is housing, because at housing rates, we're officially at 62% increase in housing, which is phenomenal. And because we're talking about dental health, there's a 41% increase, an improvement in dental health care. Physical health care, there's 21% increase. And our mental health services, there's a 29% increase in our families seeking help, seeking treatment that is beyond imaginable. And so, and then just that closer look, just a little bit. Oh, let me go back one. I want to show you this last little bit. This is the fun one. And so you can now see in Hope Hub, it just is shaped a little bit different. But I want you to be able to see that here we are currently serving 47 families. That's 115 children that are currently in foster care. So that's 115. And in April, I think our numbers were 412 total. And so this is a phenomenal thing that we are getting to come alongside. But what makes me even more thankful is, yes, reunifying our families. And as you can see here, we've reunified, at this moment in time, reunification, we've reunified 48 families. And so and this is in time, and 121 children, which is great. But, absolutely, come on, y'all. And so, of our currently active families, we're currently serving 47 cases alongside. But let's look down here. Down here in protective services. So as a whole, we're either helping in preventing foster care or preserving the family, reunification of foster children. We are at 436 families and over 1,000 children being served right now by all of you. And that's gratitude to the department, gratitude for our advocates. It's been a phenomenal journey already this year. And so, thank you so much.
Thank you.
There you
Deanna.
go.
Mike, please. All right, so we gave Deanna a hand of praise. Give yourselves a hand of praise. Good job. Community effort, collaboration. That's what you guys have done. Those numbers, that's all you, right? All right, so let's start. We had we have some handsome men that just walked into that. Hey, all right. Paul, would you like to introduce the guests before we bring our panel?
Oh, sure. We've got
Who we
some
have?
friends here from Tennessee. They heard about all of you and can't believe that you actually could do something like that. And so they were coming to kick the tires and see what collaboration looked like.
Proof is in the pudding. Y'all came right on time. Did you see those numbers? Did you see what our community is doing?
We did, yes.
And you can take it back to Tennessee and do the same thing. All right. Thank you guys for coming. All right, so we have some panelists here. Would you guys come up? Richard, you can sit on this side. Dr. Johnson, sit on this side. We have, so our third panelist, she works for Red Cross, and she had to go and help with some disaster relief. So she's on call. She couldn't join us today. However, we're still going to continue and move along with our panel. So Dr. Johnson, tell us what you do. Who are you?
I'm a whole lot of people picked in one. Good morning, everyone. Welcome. I'm really delighted to be invited here this morning. So I'm a psychologist, community psychologist by trade, but I wanted to expand that, and I became a public health professional or practitioner, where research became a very important part of my psychology career, in the sense that rather than seeing just one individual at a time, I could see the whole nation, even globally, through the research that I do. When I'm publishing my findings from studies, oftentimes get a lot of feedback from globally from all over the world in regards to some of the innovations that I have instilled into communities, particularly communities that are marginalized, under-resourced, or underserved. So I feel like my new career focus, that my new effort has actually given me more broader territory and help more people at one time.
Can y'all hear without the
Yeah.
mic? 'Cause we're
Yes.
right here. Okay. So Richard, tell us, who are you? What do you do?
That's pretty tough to follow right there. No. My name's Richard Robinson. I'm a dental hygienist at Arkansas Family Dental. Upon graduating from UAMS, I started a nonprofit called My Why. And our mission is to improve oral health in underserved communities through education and community engagement. So what I do is I go into schools, community centers, and I talk to them about the importance of oral health. Can I be transparent with y'all? Is this a safe space? It's a safe space? Okay. Let's rewind it a little bit, okay? Before I became a hygienist, I didn't know anything about dental hygiene. I was dyslexic. I didn't start reading and comprehending until the age of 36. So I took that and went back to school and became the second African American male to graduate from UAMS dental hygiene program since it began in '76. Y'all can clap for that. So after I graduated, I started my nonprofit, My Why, but I also started a scholarship at UAMS for minorities entering the dental hygiene program that I'm currently working on and getting endowed. So far we raised $10,000. We still need an extra $15,000. So if anybody wants to donate, y'all get with me on that. So being an African American male dental hygienist, there's less than 1% of us in the entire country. There are less than 8% minorities in the field currently, but I'm working on changing that narrative. So what I do when I go into these schools, I talk to the young kids. I said, hey, you want to be in the dental field? And they were like, I'm thinking about it. Well, here's my card, here's my number, here's my email address. Here's where I work. You call me and let me know when you're available because I want you to come shadow me. I provide lunch for them if they want to come in. I show them the ins and outs. This past year, I was mentoring 3 minority potential hygienists, mentoring them. 2 of them got into the program and they're starting in August.
Oh, wow.
I also go to different dental hygiene conventions. There was one last year in New Orleans. Met some great kids, group of kids from South Carolina. Mentored them through the entire year. They just graduated recently. They flew me out last month, and they're going to start a My Why in South Carolina. So I have a satellite location there. So I do a multitude of things, as you all can see. I'm a husband. I'm a father. I just love giving back to my community. You know, the underserved community doesn't get the help that they need, the education that they need when it comes to oral health. A lot of people are so fixated on the cosmetic aspect of it that people don't understand the why. Because growing up, they say, hey, you gotta brush twice a day, you need to floss once a day. But what's the why behind it? Why am I doing these things? Education is elevation. So I'm here to provide that for the next generation and the parents.
That's good, because that's part of my question that you already answered. So why is it important for us to view dental, mental, physical health? Why is that important? How is it all interconnected in working with our families that are in crisis?
I just like to simplify everything. You know, for me, look at your mouth as an open wound. It's the gateway into your entire body. When you get bacteria in your mouth and you don't get that treated, it doesn't just go away. You swallow that. You inhale that. That can cause heart problems, respiratory infection, linked to diabetes, Alzheimer's, women who get pregnant, premature pregnancy, men, ED. We don't know these things in our community because no one talks about them. So the underserved community, they don't look at it as important. You know, if you're displaced, or you're going through a crisis, that abscess is going to get worse. That cavity is going to get worse. And by the time you get to the dentist to get help, you're out-of-pocket investment. Because we all know dental insurance is just a Band-Aid. Every time you go to the dentist, it's an out-of-pocket investment for something, for fluoride, for x-rays, for something. And if you're in a crisis financially, just don't have it. Or if you're on Medicaid or Medicare, there's a list, a long waiting list. I can see you in 3 months, but you're hurting right now. We can't wait 6 months. And you just took off work to have this appointment. And we all know you take off one day, that's like half a check.
Yeah.
But you work overtime, you're like, hold on, $5? You know? So these families who are living from check to check are losing money to go to the dentist that they can't even get service for. So what can we do to change that? What does that look like in our community? You know, do we open up more dental offices? Do we need to open up more dental offices in rural areas? Maybe. You know, who's going to fund those? Who's going to go down there and work in rural Arkansas? Because I see 20, 23-year-old patients come all the time have partials in their mouth at the age of 22 and 23. They come in, sit down, beautiful men and women, hey, pull them out, hey, partials. Because they don't know, they don't understand, they're not educated. Because their parents had partials and dentures. Their grandparents had partials and dentures. So that's all they know.
What about you on the mental health side, Dr. Johnson? How does that intersect?
Well, from a mental health perspective, we look at the whole body, right? So if dental was really an indicator that that there's some other issues going on, particularly if it goes into an acute situation where you have teeth that are falling out, you don't get care, you just because you don't really go to the doctor to address it. It leads to other types of health problems, including mental health, because depression could possibly set in from not getting your dental care taken care of, and plus it affects you socially, and also when it comes to employment. You rarely would want to even go interview for a job if your teeth are not clean, because you want to smile a little bit. You want to show a little bit of that. You don't want to just be there, just kind of looking kind of numb. So dental is very important as an indicator of mental health. Indicator of the beginning of mental health if it doesn't get addressed. But when you look at the whole thing around, say, family, say, dental, physical, mental health, it's not isolated. It can't be happening in isolation. When you look at the whole body, like, if your arm is something's on your body is broken, or say it's sick, the whole body is sick, right? So we must look at how we can integrate healing to the whole entire body. So in the community, on more of a macro level, that we must be able to address all of those things at once through connecting services together. So I've only been back in Little Rock for 4.5 years. I came down here from San Francisco. I was born and raised in eastern Arkansas, and I've been gone for maybe 30 years. And just recently came back. I was running an intervention in San Francisco. I don't know if anybody's been in San Francisco and walked through downtown with all the homelessness and all the people sleeping on the streets. But and then the pandemic came and people were dying on the streets. They were frequently catching the virus, and to the point of detriment. And so I had an intervention that was more of an educational intervention that I used to turn that statistic around. And so I was working kind of with some other universities. UMS kind of contacted me and said, listen, we have people down in Arkansas in rural or hard to reach areas that's not taking care of their health. And could you come down here and kind of show that intervention to our researchers and integrate it into our protocol of how we're trying to help save lives down here? And so that's what brought me here. And intervention, we actually started getting people in the rural areas and hard to reach areas like, was it Sweet Home and College Station and you know, in areas like that, that were kind of really reluctant and distrust. But we were able to do that because we had to interconnect services and work with other providers to be able to go into those communities. And we had trucks up in those communities that were testing. You know, we had people that looked like their community on those trucks that were engaging, and people were more willing to trust and take the vaccine. So I think that this is a holistic approach, and it's very important that we actually connect services. I think that when I was introduced to 100 families, I thought it was amazing work that you all were doing because other states don't have this in many cases. Particularly, even California doesn't have that kind of connective services. So this is great.
So how does a lack of coordinated care increase the trauma or the hardship of families that are already in crisis?
Well, it exacerbates it, greatly. So people actually have, what ended up happening is that there'll be gaps in services to where if we do not have the way to connect and be able to really share the data. You know, we want to prevent people from having to go to multiple sources. You know, the gaps in going to multiple places to get care. Oftentimes they begin to start just kind of getting disappointed, or they started kind of giving up, and they just try to address their own health by themselves.
Yeah. And so in both of your field, what do you guys see as like barriers for families to even get the proper care that they need?
Man, uninsured, lack of insurance, the out-of-pocket investment, the lack of accessibility. Those are the top three there, you know. I mean, I have patients come in all the time and they're just like, you know, you need one crown. You know, if you have insurance, your out-of-pocket investment is going to be $600-700. That's just for 1 tooth. If you're on Medicaid or Medicare and you come in, they only cover $500 through the entire year. That may cover one filling if you have a large filling. So what happens in that situation? Hey, just pull it. I have $200. So if we can continue down that same road, if something hurts, we're going to continue to pull it because insurance is not covering anything, or they don't have transportation to get to where they need to get to.
Yeah, and you know, so I took notes on that, and so I'm seeing that fragmented systems requiring multiple appointments, locations, and intake processes are limited. Transportation limitations, like what you're sharing, prohibitive costs, co-pays, child care, lost wages, stigma around seeking certain, you know, when you have a mental health issue, for example, most people don't want to really talk about that. So stigma around checking certain types of help, around the type of help that you're trying to get. So stigma around mental health, you know, greatly, and people don't really feel like showing up. And also limited hours of services of where facilities are open, you know, that really conflict with their work schedule.
Yeah.
Go ahead, I'm sorry. Go ahead.
No, I just want to piggyback what you were saying with the work schedule. I mean, most people, we work 9 to 5, 9 to 4.
Right.
Most dental offices close at 3 o'clock.
Right.
So you have to take off work, lose wages. Fortunately for my office, we're open from 7 to 7. So from 5 to 7, it's prime time for us. You know, we're back to back, we're busy. You know, sometimes I'm there at 8 o'clock.
Yeah.
But if we can have a weekend dental clinic, you know, something that's open from like 8 to 1 or 8 to 2 on a Saturday, that would benefit a lot of people to where they don't have to lose those wages.
Yeah. Dr. Johnson, you shared a little bit about like when you did your research and your initiative. Can you both share a story about how you in your field of work, how you collaborated with other agencies just to provide services, or have you done that, or have you thought about it?
Well, I work with kids also in developmental psychology, and I had a family that they just were notified that the child was diagnosed with autism, and they were struggling financially, And so, but they were going through a lot of depression, uncertainty about how to address this. Autism hadn't been a historical thing in their family tree, and it was something that was brand new for them. And so, so when I came into the equation, you know, I assessed the situation and found that the best way to relieve the family so they continue to go to work and become more, you know, stable in their thinking, and they did kind of a multi-system tier of support, right? And so I was able to get them to get connected to other resources like the school. So they had so we eventually had a clinician who went into the school to meet with that child. We had a clinician coming home to help them with their parenting around autism. We connected them with an educational resource to where they can learn about how to engage with that child. And so without them having any background and history in this, it really helped them to feel more comfortable and become more supportive of their child and get the child on an even kind of kill to whereby they were able to be successful, you know, outside of the household and school, because they had a lot of support services there. So I think connecting services really helped us empower this family to not be so burdened down with their depression, with having to go to appointments, often multiple appointments, and helped to close the gap on having multiple practitioners going to multiple practitioners, which they also had a transportation limitation as well. Yeah.
That's amazing.
Yeah.
Again, that's gonna be a tough story to follow. Johnson, you're killing me. Okay. But so my wife partnered with She Build. I don't know if you're all familiar with this Anika Dixon.
Oh yeah.
And so she and I have been conversating for about 2 or 3 years now, and had some great meetings. And she brought me into one of her women's homes, or second chance women who were previously incarcerated. And we kind of did like a lunch and learn for them. And Oral-B sponsored some electric toothbrushes for the ladies. So I got those for them, and they were super excited about that. But we had a great lunch and learn, talked to them about the importance of oral health, how to brush, floss, the importance of all of the above, what it can lead to if you don't take care of your oral health. But I'll partner with the doctors at Arkansas Family Dental. We have 6 amazing doctors with over 50 years experience. I'm marketing here, so partner with them, and we love getting back to the community there. So partner with them, and they were like, hey, you know, let's take on a couple of cases. So next week we have one of the young ladies coming in. She doesn't have any teeth, she's indigenous, she's not confident in her smile, and so we're going to try to start, you know, the process of getting her upper and lower dentures. So, you know, we're going to take it one person at a time. I already told them, I'm like, look, it's not going to be an overnight fix. We're going to see what's going on. If you need a cleaning, we'll get you a cleaning. If you need a partial, we're going to work on that. But just bringing that confidence back, you know, when they're trying to get readjusted back into society, and like you're saying, applying for jobs, you know, when you're speaking to the interviewer, you know, you want to be able to smile and have that confidence without having a missing tooth or not having any teeth at all. So, yeah, that collaborative partnership.
Since you mentioned She Build, it's a grassroots organization. What do you guys think? How can churches, nonprofits, other grassroots organizations, what can they do to help with this effort of collaboration? What do you think? And this is my last question. We're going to open it up to the audience.
Well, as coming up, born into a family of ministers, I think I could probably, just from just thinking about how my family supported the community in which they served. Church is a safe haven. It's always been historically that place that we go to for, we call it the spiritual hospital, but it also offers a lot more than that. If we can engage with the leadership and say, these are the things that we need to be concerned about. I mean, once at Hoover, actually, I asked Reverend Bell now, I said, I was proposing her that if you let me do a survey in your church of how many people are suffering from depression or stressed out, just those two questions, I guarantee you 98% would say yes, right? And so those are the things that churches can be able to do. So they bring a language. So the things that churches, I've seen them also do is that when you are out in care, when individuals are in care, and the doctors are throwing all kind of medications and all kind of prognosis, diagnosis, when you go to the church, the church can actually deformalize that and make it, formalize it into your own understanding, with trained clinicians, of course, not just anyone. But, so then you begin to reduce stress associated with, oh my God, I'm sick. And now I'm on all this medication, but the church would say, okay, you follow the procedures, whatever it is, and also give you a better understanding. So I think the church is so important to be able to help connect services. They also offer a platform to where we can have health fairs there. We can have educational enrichment programs there around the importance of taking care of their health. So it's so many different ways that, I can think of many if I just you gave me a moment, but there's so many different ways. So foundationally, that is the cornerstone of our community. And we need to talk more about health and well-being at that junction.
Just to piggyback what Dr. Johnson was saying, in the churches, have those health fairs. We're partnering with St. Mark's. They're having a men's health fair pretty soon, I think next month, that we're going to help out with, just to educate the community, the men on the importance of oral health, but they're going to have other vendors there as well. Just at community centers, having oral health fairs. I know we have one large one in Conway called Our Mom, and it's just once a year, a huge dental convention where people from all over Arkansas come to Conway for those 2 days just for dental care. And that's just once a year. What if we had that every quarter, but around the state, not just in Conway? Let's have 2 or 3 in South Arkansas. Let's go to East Arkansas, in those rural and the Delta areas, That would be amazing, and not just do dental, but do mental health, just all over. But have a team and say, hey, these are the dates. And not just put it on social media. Let's do radio, let's do television. So when we show up, the people are there. And they know every year we're coming twice a year. So they'll get those cleanings twice a year. They will get the access to different doctors or where they can go, the resources. And I'm not just handing somebody a pamphlet and saying, hey, call these numbers. We're here doing the work. And if they can't get the work done then and there, then we can provide them with resources and say, okay, now I need you to call Dr. Johnson or Ms. Smith or go to this dental office because they're going to provide you with A, B, and C. And this is what you need. And they have that. It's something that's tangible. But not only give it to them, email it to them, text it to them. So now it's in 3 different spots. So they can't say, oh, I lost the paper. No, we emailed it to you. They can check their email. Check your text message. Everybody's on their phone texting all the time. So it's there. So I think that's something that is tangible. We can actually make that happen, with the right group of people.
I was gonna say, I wanted to give, props to Amber. She's in and out, but I want to thank Carter's crew for letting us host our Alliance meeting here. But we're going to open up the floor now for any questions from you all that you may have or comments, whatever. It's time to have an open discussion now. Anybody? Any questions, any comments, any final thoughts?
Well, I would like to, I'd like to interject and include in this conversation how important research is. I always knew it was important, but many of us are not thinking about it. We got to prove the science of what's happening. This, what you're talking about interconnectedness and communities, it's a science. how do we do that scientifically to where we can be as effective as we possibly can? You definitely have to do program evaluations and see how you're connecting, and you see what your outcomes are, how impactful you are. So oftentimes researchers come into communities that are I call it under-resourced. I don't want to say underserved. And so it's under-resourced because we need more resources. And they take a lot of information out and, around poverty, around health, and the interventions that they derive at are often not brought back to be disseminated into the communities in which they are researching. So now I have an initiative now to where it's going to be community-based participatory research that's going to be done by people that have lived experiences in the community, and I think we have a better outcome, and we'll be able to look at all these systems and what you all are talking about, and being able to measure, the effectiveness of it, so we can look at what the gaps are, fill them in, and make it better. Look at what doesn't work and what's not working, and find the things that do. So so moving forward, I think that more research needs to be conducted around how we connect these things effectively. And so I just want to say that, and I would really, really appreciate 100 families' participation.
And you're in Norfolk, so anybody can refer.
Yes.
Thank you, Dr. Johnson. Yes, Anthony.
Yeah, I'm Anthony. I'm a counselor at Hoover Treatment Center,
Oh.
and I'm sure all of us are. What I hear is lack of funds.
Yeah.
So not only in the consumer's pockets, but in the provider as well. And data and the proof of outcomes is extremely important. So how are you specifically? You just mentioned it, but how are you specific, or how can we work with you, or what's the process to develop those research priorities and then put together something that we can then leverage to help us, increase our funding?
Yeah. So I'm very, very familiar with Hoover Treatment Center. I've been around that place for a long time. Right? So I have already collaborated with Hoover on some things. Particularly when the COVID was happening, we were making sure that we had those people, engaged around, that were inside treatment, that they were tested and they were also educated about, when they are leaving the center to go back to the community, how to take care of themselves. So what happens is that I kind of look for problems that we are having in our community. Right now, my focus is on the reentry population. So we have a new prison going up in this state, and that's a lot of people going to be going to jail. They got to fill those beds. And a lot of people are going to be getting out, right? But a lot of them are getting out now. They're really, like Paul was sharing, there's not going to be any more parole or probation. So they're going to be getting out and coming to what? So now we're looking for how do we support those individuals inside the jail 3 months before they get out, or 6 months even, depending on what the nature of their issues are, because it could be mental health, historic trauma, just whole generational trauma, or lifespan trauma. So we'll be able to go inside and assess that. And then we'll help them kind of prepare themselves for kind of a soft step down when they get out by providing other type of support services. So right now, I have a study that's active right now where we're giving individuals that get out of jail $500 a month for 6 months to see if it really reduces the stresses associated with reentry. You got your fines, you got your fees, your housing, your transportation. So how can we, is this going to be able to be effective to reduce recidivism? It's really more like a supplemental income or Social Security check, very similar to how that works. And if it proves that it's really making a difference in there, because the whole goal is to health. So our end goal is to make sure that health and health-seeking attitudes are instilled in individuals that have never taken care of their health, right? Unfortunately, we have some things going on in Washington that's kind of holding us up. But, however, there's other funding sources that are coming to our rescue to help us get this done. So we've already distributed $500 to 230 black men in Little Rock, Arkansas. They live. Yeah, they live 400% below the poverty line, and they may have a chronic health condition, and they may have a criminal history. We don't really bother about that. We don't care how they spend their money because we wrap other type of supportive services like financial literacy, mental health, and counseling, and other type of enrichment programs to help them to be able to understand how important it is to manage that money correctly because they try to go somewhere successfully. Yeah.
So make sure y'all network and talk to Dr. Johnson about how your
Yeah.
families can get connected to that resource. That's good. That's good information.
I have a question about that. So with the reentry services that you just mentioned, is that for individuals that you actually go, that are currently incarcerated, that you begin working with before they're released? Or do individuals that have been previously incarcerated, do they also qualify for your reentry services?
If they have had any encounters with law enforcement and been incarcerated, it could have been 10 years ago. We know the trauma associated with incarceration. And so it doesn't stop when they get out, right? So there's no limitation in time. However, I would say that there's the secondary study, which is a supplemental study that we're doing, particularly around education. So individuals that go to college, because now we have college, like we have Philander University, we have Shorter, and other schools in the state. We have Arkansas State, that's in McPherson, which are primarily dealing with women, and we have Southeastern College in Pine Bluff. So we have over 750 individuals inside Arkansas prisons that are getting a college education. Right. So we want to support them, so when they get out, because sometimes, probably maybe a large percentage are just doing it to get out of their cell, right? Just going to school to do something different to kill some time because they got time, right? We are aware of that. So our hope is that they'll get caught up by the bug of like I'm learning. I'm told I can't learn all my life. I wasn't good in school. I dropped out of school. Many of them we see do that, have done that, and so we want to support them. If you continue your education when you get out, we will give you money as well to be able to increase retention, to keep you going forward, and a lot of other support services around. So that's more specific to education. So Shorter is our primary partner. Shorter has 495 students in prison. Shorter has more students in prisons than any other university in the country. And that's probably about 300 universities. And so we want to support Shorter. So it's a lot of good stuff going on around it right now. And you are going to start hearing about it in the news because we're just beginning to make some leeway and get some outside resources coming from outside of Arkansas support.
Yes.
Any more questions? Parting thoughts? Yeah.
Okay, so I got another. Okay, so you talked about health fairs and collaborating with different organizations to kind of show up and provide resources on hygiene and toothbrushes and so on and so forth. Is that something that can be set up moving forward with other organizations? If we're interested in having a health fair or some type of dental.
Apparently she's making some work.
Everything that both of you have spoken about today has touched on the work that Amber and I do. We have so many of diverse clientele, and yeah, we need to talk to both of y'all. We're gonna corner y'all afterwards.
What's the organization?
So we work with Goodwill Industries, and we have a disability services department. We have a reentry services. We have a high school for non-traditional students ages 19 and older to get a high school diploma. We have a trade school for individuals that can come in and they can get certifications and licenses for different trades. we deal with a very large homeless population. We have a lot of people that come in that have been previously incarcerated, that are in need of second chance opportunities. A lot of our students are under-resourced. A lot of our clientele, of course, with us dealing with such a large homeless population, under-resourced. So we deal with a lot of people that just need a whole lot of help, and resources are limited. So that goes for everybody in here. Any way that we can collaborate. We have a health program for individuals with disabilities, and they get free. Yeah, so we do a lot of stuff, and we need as much partnership and collaboration as we can get.
Yeah, my wife would love to come in and talk to any of those groups and do a lunch and learn, 45-minute lunch and learn, and we can discuss the importance of oral health, and we can even hone in on that, those younger non-traditional students, high school students, or young adults. I went back to school. I graduated in 22. I was 41. I was when I was in school. Like, I got a bunch of 19, 20-year-old young ladies who were like, Mr. Richard, this and this, blah, blah, blah. So, hey, that was me in school. So, I'm a firm believer. If you don't like what you do, pivot, find out what you love, and become passionate about it. Like, they print money every day. So don't worry about the check. You're going to make money once you find what you're passionate about.
Yes.
They're printing money right now, so I ain't giving a lot of it away, but that's another story. But, so whatever you need me to do, and my team at Mile Y, we will be there. And we can hone in on those students who are like thinking about a career in dental hygiene, and we can do what I call, we're working on Mile Y University, where we come in, we did one in Pine Bluff a couple of months ago, where we'll bring the typodonts, which are the fake mouths, dental instruments. I'll bring our big screen in, and we can go over dental x-rays, we can go over trauma patients, we can show them how to use instruments, how to properly brush their teeth, things like that. Like, kind of a day in the life of a dental hygienist, but I would do it on site for like 10 to 12 kids. So we can do that as well. Yeah.
I really need to talk to you. I really.
But listen, y'all want to talk, because I'm just sitting here, I'm not saying anything, but I'm going to get y'all number as well.
Yeah.
But I work at DCFS, and I tell people, we have families that, of course, we remove children, but we have families that just need that extra support.
Yeah.
They have reached a hard time, but that doesn't mean that they don't love their children, that they can't, bounce back. So I definitely want to give your number as well.
Yes.
Now, also, I was thinking about our kids that's in our extended foster care program. Our kids that are 17 to 21, they get a chance to stay in foster care and receive their support. So I think it would be great for you all to come out. So I'm gonna let them talk to you, but I want to get your number as well. But I also want you to come out as well, because I'm the community prevention administrator for DCFS. And so my job, I tell people in a nutshell, is to try to prevent children from entering foster care. If I can reach parents on the front end to find out what's going on, what barriers you're facing, to either whether your kids are not going to school, whether the discipline is inappropriate, because sometimes people just don't know. I tell staff all the time, especially, I'm just being honest, especially with African Americans, we get a lot of clients where they spanking with extension cords, or they spanking with switches, and it was done to them. And so nobody has ever told you, you can't do this. That leaves permanent marks. So when I see staff in an uproar, Ms. Torres, I'm bringing them in foster care. No, let's sit down and talk. And so anybody in here that has a program that could benefit our families to help prevent kids from entering foster care, because I'm gonna be honest, I've been doing this for 23 years, and once these kids enter foster care, it's like pulling teeth to get them back home. Because now you have the courts involved, you have different attorneys, and I love our attorney at Lyons, but sometimes it's hard for them to get past what a parent did. And so my thing is, how do we get past it? What can we do to rectify whatever is going on? So to some people, they look at it as it's easy to just remove, but our goal is to keep these kids with their families. So anybody that want to, connect, please, give a number and I'll get yours. So yeah, y'all can have them, but I want to get that number as well.
And that's what this is about. This alliance, that's what it's about. Not only are we here to help families get out of crisis, but this alliance is for the community, by the community. You all connect, you network, but one of the things that we also have to say, we have a system called Hope Hub, so you can communicate in a HIPAA, FERPA, COPA compliant manner. I say that. But who in here is already, or who's familiar with Hope Hub? Who's been trained on Hope Hub and is familiar with Hope Hub? Good. If you're not,
You're not resident.
yeah.
So yes, you are.
If you are not trained or aren't familiar with it, we have sheets in the back. You can just scan the QR code, sign up. I can come and train you and get you familiar with the system, and you can connect. You can refer families as well. We have a form in the back, so if you need to refer a family, you can refer them to the 100 Families Initiative where they're assessed. You can have access to that data, but when they are assessed, they're assessed in 13 areas of social determinants. Mental health, dental health, those are 2. But they are assessed in those 13 areas, and then we start building wraparound services and what we call a care team around those families. So you guys are added to the care team, and you can communicate with one another on behalf of those families that we're serving, okay? We have anything else?
Just one more thing, like,
Yes.
my life is just not limited to the Pulaski County area. We were just in Texarkana last month. You know, we can go to Northeast Arkansas, we can go to Union County, the El Dorado, Smackover area. So, you know, let's just not think Pulaski County with Mile Wide. We're all over the state of Arkansas. All right, so if, you know, as long as you give me enough time to get my team together and we can put some dates on the calendar, we will travel. We'll get there. All right.
Awesome. Anyone else? Anyone have any announcements, any events coming up that you would like to share?
Good morning.
Good morning.
Good morning, Dr. Nagel with Village Public Health. On June 8th, we will host a wellness fair that will cross all 9 dimensions of wellness. This is in collaboration with Little Rock Black Pride. The purpose of Village Public Health collaborating with them was to create a sense of unity. This is not a time for us to isolate subsets of population, but an opportunity for us to come together and embrace everybody. And so we are welcoming speakers that cover the 9 dimensions of wellness. We will have a stage. We will also be doing testing. You guys may not know it, but the state is in a syphilis outbreak. You also may not know that when it comes to gonorrhea and chlamydia, the majority of the cases are amongst 13 and 24-year-olds. And we're on a mission to change that. Because I take issue with the fact that when we look at gonorrhea and chlamydia in the state, the predominant cases are amongst Black and brown youth. And it's something that we don't want to talk about.
Thank you. Can you get that information to, you can email it so we can give it to our alliance? And also, there is another feature in Hope Hub. It's a community forum. So you guys are, if you're in the system, if you're on Hope Hub trained and have a profile, you can actually begin conversation inside of Hope Hub amongst each other. And you can also list like information and events on there so people can start talking, and it can be a buzz. So make sure if you're not in Hope Hub, get in Hope Hub. I mean, that's my job. I gotta sell this platform. So yeah. You wanna?
Yes, I do.
Yes,
Okay, so I know y'all tired of hearing about me, but, so I'm gonna stand over here, cause I got flyers I'm also going to pass out. So, like I said, I'm with Goodwill Industries, and we are actually having a, career and resource fair on May the 29th from 10 to 2, and I would like to invite each of you out to participate in that, whether you come as a vendor to set up, and provide resources or information, or if you just come out to see, the other vendors, meet with the other vendors that are there, network, but if you guys can come out and offer anything to our community, then it would be greatly appreciated. But if y'all don't mind, I would like to pass these flyers out.
Awesome.
Thank you so much.
Thank you.
My email address.
Anyone else? If not, oh,
I just have a question for you afterwards.
oh, okay.
I don't
Yeah,
know which
yeah,
one
we'll
to
get you
choose,
there.
which training to choose.
Gotcha.
Go.
Connections. No,
Okay, thank you.
So let's give our panel.
Yeah, thank you guys.
And we thank Carter's Crew. Amber Govan is the founder of Carter's Crew. after school. Who's here for Carter? Everybody good? I want them to kind of tell you what they do here. But it is an after-school program, and they offer a plethora of services. I don't want to start naming because I don't know all the things that they do. But Carter School is a great resource as well. If you are wanting to host our next Alliance meeting, which will be in June, get with me, or any Alliance meeting, June, July, August, September, whatever month out the year you want to host, just let me know. We have had it at Goodwill. Goodwill has hosted PCD, the community developers, of course, in Kansas. But if you would like to host an event or an Alliance meeting, just let me know, because we want to be able to be in the community and actually have people to come to your sites, to your places, so they'll know that where you are, what you do. But thank you guys so much for coming. You can use this time now to network, talk to each other, ask questions, and get phone numbers and all that good stuff. Thank y'all for coming, and we'll see you next month.